we'll be reviewing the VikingXL. This is indicated for your Max Assist patient. If you reference your quick mobility screen, this is that patient in that red row and they have no trunk control, but you need to do a total transfer such as chair to bed. It should be plugged in when not in use. That's how the battery is charging. You unplug it to use it. You have a basic remote with 2 up and down arrows. The thicker up and down arrows are the normal speed. The thinner arrows are a slower speed, and then the 2 buttons at the bottom separate the base and bring it together. Your emergency release is this red handle here, so you would rotate it to the left and it's gonna lower the lift down. It's at its lowest lifting point right now. So you're going to need a seated sling to do this transfer. This is what the seated slings look like, or it'll be a blue base, and it has the size on it. This is a size large. When the patient's sitting in the chair, you just need to get the bottom portion of the sling to their tailbone, so as long as it's touching the seat, you know you're there. So you're gonna ask your patient to sit forward slightly, and if they cannot, you're gonna get a second person to help you so they don't fall out of the chair. You're gonna bring that sling around, holding the bottom of it just until it touches the seat. Then you're gonna bring the legs around, making sure you don't catch the chair, securing it underneath the patient's thigh, double checking that their hip is inside. And you're gonna go around to the other side, making sure you're lowering yourself down and not bending at your waist. Does that feel secure around your hip?
Yes.
All right. So now we're gonna get our lift. We're gonna bring it around. And we're gonna try to get the attachment bar as close to the loops as possible on the sling. This one shows you that that's where the head goes. So I'm gonna bring that in. And I'm gonna use the loops to attach here. And the other loop here. And then we're gonna take these at the legs and they're actually gonna crisscross. So the right side is going onto the left lower loop. The right side, or the left side is going onto the lower right loop. Go ahead and give yourself a hug. So always being mindful to communicate ahead of time what you will be using to get your patient transferred and what they can expect. So go ahead and just relax. Notice I kept the base unlocked. That's what is recommended per the instruction for use manual because this is going to find the patient's center of gravity. So you see it moving back slightly, that is normal. Make sure I don't hit the TV. And you only need to lift the patient as high as the transferring surface. So we're going to be taking the patient from the chair over to the bed. So being mindful of your back, that you're moving your whole body and not twisting from your spine. All right, and being mindful of the patient's body. Bring you over. If you notice, the base of the machine actually goes underneath the bed. You have to lower the height of the bed. And see if I have more room to raise her up a little bit. And you also have all those buttons on the base of the machine as well. So getting that patient to bring their legs up and positioned over the center of the bed. So that emergency release, if it was not working, you would be able to rotate it down. But we don't need to use that because we've got our battery that's working and the lift that's working. So we're lowering the patient down. You can always put the side rail up on the opposite side if you do not have a second person, encouraging the patient to sit back so the spreader bar does not hit them in the head. The weight capacity of this lift is 660 pounds. Once the patient is lowered to where you have some slack on the sling and you know you can easily bring it off, go ahead and take it off. And bring it away from the patient, holding it so it doesn't swing and hit them. When you are done using it, please make sure to plug it back in so that it is charging. There is a red emergency release here as well that will stop the lift from going up and down. If that is pushed in, the lift will not charge. When you've unplugged it, if the lift is not operating, double check that that has not been pushed in. That's it.